Good morning, everybody. Happy Friday. This is Adam Mayberry, Lead Public Information Officer for the Joint Information Center with the Incident Management Team responding to the COVID-19 outbreak here in Washoe County. Good morning. It's Friday, April 24th. Tuning in, we have lots to talk about in a 30-minute window we have. A couple real quick announcements. We do have a regional town hall meeting that can be viewed on the City of Sparks Facebook page. Our focus will be on public safety and health and wellness. That will include all the police and fire chiefs in our area, sheriff, and other health and wellness experts. Appreciate Colo carrying that feed live for us as well. Hopefully tune in and get some good sound and video. Also, we'll continue these virtual press availabilities, press conferences next week, Monday, Wednesday, and Friday as well. Again, we'll continue this press availability next week, Monday, Wednesday, and Friday. We're going to lead off with our registrar of voters for Washoe County. Deanna Specula is with us this morning. Deanna, thank you for coming on. She's been with the Washoe County Registrar's office since 2011 and has been the registrar since October 2017. So Deanna is here to share with us how they intend to administer the 2020 primary election in this unprecedented time that we're in now. So good morning, Deanna, thank you for coming on.
All right, thank you, Adam. Thank you everyone for being here today. As everyone is probably aware at this point, we are fast approaching our June 9th primary election. So with this election, I know there's been a lot of changes. Some of the response from the COVID-19 efforts that my office, along with all the other county clerks and registrars in the state, along with the Secretary of State, Barbara Sagafsky, we jointly agreed and have been working on doing our primary election as an all-mail-in election. This is quite a change from what our residents are normally used to as far as voting procedures. So this is a good opportunity for me to reach out to everybody and give a little bit more information on what to expect in the upcoming election cycle here and how absentee ballots work and any other information that I can provide to our voters so that they and potential registrants, any information I can provide to help them register and participate in this election is kind of the goal today, for me anyway. Sample ballots have gone out. I received mine yesterday. So these are our sample ballots. It's a little bit different than we normally send out. It's more of a condensed version and it explains there's a lot of information in there for voters. Basically explaining how our election is going to run for this primary. It was very important for us to get that information out before people started receiving their ballots because we want to minimize the risk of confusion. And we're hoping that not only with our sample ballot going out a little bit earlier than normal, but also working with our communications team with the county, that we're going to be providing that information as often and in as many venues that we can so that people are aware that they will be receiving a ballot in the mail and that we really strongly encourage that they vote that ballot by mail and instead of doing the normal in-person voting. It's basically, it's our effort to mitigate also the spread of COVID-19 and that we're wanting to protect our citizens, our poll workers, my staff and county staff as well. We want to make sure that we're ensuring that everybody is safe and secure and that that health concerns are of a primary importance across the state. So with that, our mail-in ballots will be going out. They will be hitting mailboxes. Probably they'll be dropped at the post office on April 30th. So the majority of voters will be seeing those shortly after in their mailboxes. We have on our website a wealth of resources for voters. We have information about absentee voting. We have videos on how to mark your ballot and return your ballot. We have those in both English and in Spanish. So those resources are available on our website, and it's www.washoucounty/voters. And the links would be the absentee ballot or mail-in voting links. Also, Washoe 311 is available to take calls and also help people, direct them to either the mail-in ballot information or to help assist with their questions in regards to how we're operating this election with all mail-in. So now that we got that in, so some of the deadlines that are coming up, people can still register to vote by mail or through an outside agency such as the DMV through May 12th. After that point, they can still register online. And the online dates that will go through May 21st if you want to register online and still receive an absentee ballot. Starting on May 22nd, you may still register to vote online, but at that point you will have to go to a polling location to vote in person, and that includes updates or new registrants online. Our early voting early voting schedule is also in our sample ballot, so people will have that information. Early voting begins on May 23rd and runs through June 5th. During that period, you can still register online and go in person to vote through June 4th. After that, June 5th and June 9th for Election Day, you'll have to appear in person. I know these deadlines are slightly confusing, but they are outlined in our sample ballot, and we also do have that information on our website as well. And of course, anybody's also encouraged to call Washoe 311 or our office at 775-328-3670 to get additional information, or if they have any questions as far as registration and when they can appear. Of course, we always encourage people to call if they have any questions. So I know this. We do have one polling location that will be available for in-person voting, and that will be at the Washoe County Complex on 9th Street, and it will be in Building A. So we have accommodating same-day registration, any in-person updates, or if anybody feels that they would like to appear and vote in person, we are not going to deny that to anybody, even though we've sent them a ballot. Again, we strongly encourage them to vote that ballot, but if they really want to vote in person, our location will be open for in-person early voting and Election Day voters. We always, of course, with the restrictions around COVID right now, we don't know when restrictions are going to be lightened. So at this point, we are preparing to keep the social distancing. So we'll be moving our machines so they're 6 feet apart. And if you come and you're standing in line, we will be asking everybody and enforcing everybody to stand 6 feet apart. Please wear your protective masks to the location. Our poll workers, we are deploying, of course, face masks, gloves, disinfecting equipment, alcohol wipes, and they will be disinfecting equipment and basically after every use. That includes the voter cards, the machines, the tables, anything that's being touched. They'll have to wipe down and make sure that we're sanitizing after each voter and then for the next person to come up. So we're ensuring that we're protecting our staff and, of course, our voters out there as well. I don't know. There's again a lot of questions regarding the absentee ballots and how to vote by mail. Really, it's very simple. You'll get a ballot in the mail. You will just, of course, take it out. This is our return envelope. If anybody, and we have instructions on our return envelopes so that people are aware of what they need to do, where they need to sign to make sure that their ballot gets counted, and then fold and seal it for them to return it to us. There's, again, those 2 videos that we have on our website to walk people through that process. And again, we have it available in both English and in Spanish. At this point, I don't know if anybody has any questions that I haven't covered.
Yes, Deanna, Scott Sonner at the Associated Press. Can
Hello.
you hear me there?
I can
Yes,
hear
great.
you.
Thank you. Thank you so much. I'm wondering if you've been able to project at all the number of voters you would anticipate showing up either on election day in person or on early voting. Is there any way, do you have any sort of guess at that at all?
Well, at this point, the state has done some surveys, and it looks like there's a potential for up to 40% of people may want to appear in person. Again, that's just a small sampling survey. At this point, we really don't know, especially since we had enacted in this last legislative session AB 345, which now opens up the same day registration. So in anticipation, of course, we were preparing for the most that we can accommodate at our location to make sure that we have enough intake stations and enough equipment to accommodate those people. But this is our first year doing same day registration in Nevada, so it's really, we don't have a lot of estimates on what we would expect for people who, especially those that would need to appear in person to do same day registration. That's why we're very much encouraging people to go online and do their registration if they can. It's going to speed up that process in person if they've already are already in our system. That way, it's an easier intake process for them. They just need to check in, sign the roster, and then they'll be able to vote. Taking registration and doing that in person takes a little bit longer. Again, we can accommodate it, but of course, if people can do that before they appear, it makes it much faster for them and everybody else in line.
Hi, this is Ann Jeanette from the Reno Gazette-Journal. Historically, on election night, absentee ballots sometimes cause a logjam in counting. I think maybe your administration or maybe your first year there was something like that, but I'm wondering if this is doing anything to prepare for that kind of massive counting task that you're going to have with all of these absentee ballots.
Yes, thank you for the question. That is a very important question. Yes, we are. We're making a lot of preparations on our end now to make sure that the processing and checking in of ballots goes as quickly and smoothly as possible. We've also contracted with our vendor who provides our equipment along with the state. Their participation in this has been very helpful in our preparing as well. And we're going to expand our capacity. We're going to double our capacity to count and run those absentee ballots. So of course, on our planning end, on the front end, of course, making sure that we're going through the processes of checking those ballots in and getting them prepared. We have a significant amount of staff who are going to be on hand and available to do that process. Once they get checked in, we can start prepping them and getting them ready to run. And so by expanding our capacity, basically doubling it, we are well prepared to be able to make sure that we're tallying those votes as quickly as we possibly can. So.
Do you start tallying them on election day, or do you start counting them as they come in?
We can start processing them 4 days prior to the election. That's 4 business days prior to the election. We can start running them through the machines. However, we cannot tally them until we are approved by the Secretary of State to go ahead. All polls are closed is the notice that we get from them. And then we can start releasing those results and tallying. But we can start processing them before.
Thank you so much.
You're welcome.
Any other questions for our registrar? Great. Deanna, thank you very much. Have a wonderful weekend. Appreciate the information today.
Thank you.
Keeping our democracy moving forward despite COVID-19. Thank you. We're going to go now to, we have on the phone our Deputy Incident Commander, Scott Stevenson. They don't have a video capability yet. We're working on that, so you'll just be hearing his voice. Scott has an announcement to make with regard to testing, so I'll let Scott provide a few remarks with some questions, and then we'll conclude with an update from our health officer, Kevin Dick. Good morning, Scott. Are you with us?
Good morning. How are you?
Good, sir.
Okay, so the team has been given very clear direction from the governor's office and the agencies who we're working for to increase the testing capabilities. With that being said, the incident management team is working diligently with the health branch to increase testing to 1,000 by Monday. We know that we have limitations and that we're not going to be able to make that by Monday. That is a target that we're going to try and diligently work towards. The testing will still follow the criteria set forth by the health branch. That has not changed yet. There will be plans developed to move out of symptomatic people towards the vulnerable population and asymptomatic people. For details on that, we'll get those out as soon as we get those plans made. Some of the limitations are going to be the lab capacity and the testing materials available to us. Those are what are going to hold us back. The staffing to do this testing with the National Guard that's been given to us to use is a good force multiplier, and it's going to allow us to get that testing done. Kevin can talk more when he comes on about the strategies and what more testing does for us with regards to epidemiology and working towards opening up the economy. Is there any questions?
Adam, I think you're on mute.
Yeah, I have one question. It's Bill Denser from Review Journal. I just want to be clear. You said 1,000 by Monday. You mean 1,000 each day, correct?
That's our target. And again, we know we're not going to be able to make that. That's the target we're putting out in front of us. Again, that's been set forth by the governor's office and the agencies that we're working for. So that's a target that we're going to work towards.
Great. That's what I thought. Thank you.
This is Siobhan from the RGJ. You said you won't hit that target. What will you hit on Monday?
The limitations with the lab capacities and the testing materials are going to dictate that. We're working feverishly with all of our partners, the hospitals that have testing capabilities and other avenues to try and up the ante on just how many we can get tested and process those tests.
Thank you.
So, Valentina, can you hear me?
We can. Go ahead, please. Thank you.
So those tests are only for people showing symptoms, right?
Right now, we have not moved out of testing symptomatic folks.
Do you plan to do that, and when?
As soon as we get caught up and are able to up ramp the numbers of testing and get caught up with anybody who is symptomatic, there will be plans made to start hitting the vulnerable population, such as nursing homes, and plans later on to start testing asymptomatic people.
And Valentina, we'll be rolling out details in the next few days to come, but we wanted to get this information out generally now.
Thank you.
Thank you, Scott. If you can just stand by, like to turn the time over to the health officer. Kevin Dick is with us. He can provide an update on where we are today and any other additional details. Good morning, Kevin.
Good morning, Adam, and thanks everybody for joining us today. I'm Kevin Dick, District Health Officer. Sadly, we've lost two additional residents of Washoe County to COVID-19 that we're reporting today. One, a female in her 90s with underlying health condition, and the second, a male in his teens with underlying health conditions. And so these are tragic deaths, and I think very sobering to see a teenager from our community pass away from COVID-19. And I think this is important for our entire community to understand that everybody is vulnerable to COVID-19. regardless of age. We know that our older population is hit more severely by this disease, but a person of any age can be hit severely and can pass away from COVID-19. We also, this brings our total COVID related deaths in Washoe County to 24. We have 19 new COVID-19 cases in Washoe County that we're reporting, and we have 17 additional individuals who have recovered from COVID-19. So our total COVID-19 cases are currently at 755. As I said, we have 24 deaths from COVID-19. We have 241 individuals that have recovered. Our active cases are at 490. We currently have 42 individuals hospitalized in Washoe County, residents with COVID-19, and we have 50 people who have been discharged from the hospital to date. So as was mentioned, we're continuing to work on testing. We have our post that's in operation today. We expect to collect about 220 samples from individuals today, and we'll be operating again tomorrow. We are testing all people that have symptoms that have contacted us through our risk assessment process that's available both by phone at 328-2427 and via our website to be able to do the risk assessment online. So we're encouraging to have people contact us for that risk assessment. And we very much encourage everybody, particularly including our Latino and Hispanic community, to take advantage of the opportunity that we're providing free of charge to be tested. We did release demographic information yesterday, and consistent with what we're understanding nationally, we are seeing a disproportionate number of people in our community that have contracted COVID-19 in the Latino community. And I think that there are a number of factors that contribute to this, which include that many of these people are part of our essential workforces in various business settings and are in an economic position as well, where it's more difficult for them, the majority of the positions that they're employed with, to be able to work from home or remotely. So I think those and the socioeconomic disparities that we have in our community contribute to that. So everybody with symptoms, please reach out to us. We have the capacity to have you tested. As Sam addressed, we are working diligently to expand our testing capacity. And initially, our available testing capacity will be provided to our vulnerable populations, and that includes, as you mentioned, nursing homes, long-term care facilities, our healthcare workforce, as well as our first responders. And we'll be working together with the governor's office and the state's medical advisory team, and state DEM, the governor's task force on the criteria that we'll use, the strategy and approach for the testing as we move forward. I would caution from people thinking that we're moving immediately to mass testing where everybody in the community that wants to get tested is going to get tested. We're developing the criteria and the framework for how we expand the testing as we move forward, and also looking at how we'll be utilizing the existing COVID PCR test that we've been conducting And as the antigen test becomes available and we have information on its specificity and reliability, the role that the antigen test will play in our strategy. But by challenging ourselves with the build out of capacity for the testing, that's challenging as well. Our partners in this effort with how we are able to secure the supplies that we need, the swab collection kits, the lab capacity to be able to provide that increased quantity of testing. We do have federal resources that will be available to us through the legislation that's moving through us from Washington that has $25 billion of federal support allocated in there to support testing, the equipment and resources for that, and the contact tracing. The hospital capacity for our area remains good as of April 22nd. We had 60% of our acute care hospital beds in our short-term acute care hospitals were occupied, and we had 54% of our ICU beds were occupied. 27% of ventilators were in use. We're continuing to watch our daily case counts, and we're also watching the models. The Los Alamos model, that's the one that we think is tracking most closely with our situation, was updated yesterday, and it's consistent, I think, with what we've been seeing. It hasn't really changed that much, around an 80% probability that our peak has already occurred. And if it hasn't, the highest probability over the next couple of weeks that we have attained a peak. But I would like to also emphasize that as you look at these numbers, and the Los Alamos model is a statewide model, that it's not a sharp peak where it's going up rapidly to the peak and coming down rapidly off the peak. It's a plateau in cases that we've reached. And from what we're seeing, it's going to take us a while to come back off of that plateau and have further reduction in cases that are occurring. So that's the reason that we're continuing to message, and we will need to for the future until we have a vaccine available, that people need to take action themselves to protect themselves from contracting COVID-19 and from spreading the disease. And I think everybody knows well what those are at this point, with staying at home, only going out for essential purposes, covering your face when you're out, and the hand washing and cleaning of high contact areas, not going to work if they have any symptoms, and contacting us and getting tested if they do. So we're in this for the long haul. I think that we're maybe reaching the end of the beginning, and we're working now on how we can move forward to have the resources deployed to be able to support our needs in moving into the next phase as we begin to gradually open more businesses and more economic activity, while we diligently work with identifying any cases that occur and ensuring that we're having quick isolation and quarantine of those individuals. So that's my briefing today. I'd be happy to take any questions.
Thank you,
Hi,
Kevin.
Kevin. This is On with KUNR. So with the new target number of 1,000 tests a day, I know you said that there were shortages. What primarily are the shortages right now in terms of numbers? Like how much more of each thing would you need to meet that target? And why 1,000? How did that number come about? Like, why is that the target?
So as far as the limitations with our ability to test 1,000, we have the number of test collection kits that we have available. We currently don't have 1,000 collection kits available at the health district, so we need to ramp up our resupply of those. And FEMA is working with us on that. The state lab and UNR and the the Carson City Library are also working on developing the capacity for production of test collection kits. So that's one of our limitations. The other limitation that we have is our current lab capacity at the state lab of about 500 tests per day. They're working on approaches to expand that to 1,000, but we also need to be looking at what are the opportunities as we have more funding coming in to secure additional automated test equipment to continue to ramp that up. I think another limitation that we have is the system that's established statewide as University Medical Center ramps up their testing capacity in Las Vegas through their partnership with the Arab Emirates. How we're coordinating the allocation of additional capacity as it comes online to support needs across the state. So we're continuing to work on how we get that system developed. They don't have the additional capacity now to support us, but they may in the future as they're ramping up those operations down there. As far as the number of 1,000, that's a number that's come out of the governor's office and the state division of emergency management. And it's I think it's a stretch goal for us right now, but I hope that we will be able to achieve that and then continue to build to have capacity beyond that as we move forward.
Just a quick follow-up. So how many tests are we on average doing a day in Washoe County? And is there even a demand for 1,000?
So as I've looked over the data on the number of tests that are reported to the state that have been collected in Washoe County, it's about 240 or 250 per day. And currently, we have the capacity to test all of the symptomatic individuals that identify themselves to us or are being tested through the healthcare system. As we move forward, we want to expand that testing capability so that we're ensuring that our healthcare workforce is able to be maintained, and we understand and can identify in that system if there are people that do have COVID-19, so we can take the protective measures to exclude them or isolate them, as well as in our law enforcement population to ensure that we continue to have those essential resources for our community as we move forward in the reopening. And then we also want to have additional capacity available as we have businesses reopen so that we are ensuring we have adequate capacity for additional symptomatic people that we may have. The other piece of expanding the testing is in preparation and with our hope that we have a good antigen test that we can use in the future. Currently, the COVID-19 testing that we do just tells us at the point of time where you collected the specimen from that individual, did they have COVID-19 virus in their system that was collected on that swab? So it's a point in time test. As we get the antigen test developed, that will allow us to better understand how many people in our community may have been exposed to COVID-19 and developed the antigen. We are aware that there are a number of cases that people don't develop symptoms, a number of cases where people have mild symptoms. And so we
Kevin, you're muted.
Yeah, I was wondering if it was just on my end or not. Kevin, I think we lost your sound the last 60 seconds or so.
What happened there? But thanks for letting me know.
Okay,
Um,
thank you.
What was I saying about 60 seconds ago? You remember?
No, but
Okay.
You were talking about the herd immunity with antigen testing.
Okay, thank you, Juan. So what we hope is that there is immunity, and if we can get that information of what part of our population has been exposed to COVID-19 and develop the antibodies to it, that will also help us better understand what the potential is for the spread of disease in the community in the future. The more people that
Kevin, looks like we lost you again.
It's just automatically going on. So just shout at me, Adam, every time that happens. But if they have been, we have more people that have been exposed and have antibodies, that reduces the potential and the speed of spread in the other remaining population that haven't been exposed.
Okay. Did you copy all that?
I did. Thank you very much.
Kevin, this is Siobhan from the RGJ. Can you tell us more about some of the circumstances of the teenager? I know that's going to scare a lot of people. Was the teenager hospitalized? What part of town? Do you know anything about where the teenager may have contracted the coronavirus? Everything you can tell us about the teenager would be great.
I'm afraid I don't have much information right now. I just heard about it this morning, and I've been running from one meeting and call to another since then. But the information that I had is tragically, there was a rapid decline in this individual who went from being a healthy teenager to being deceased from COVID-19 in about 5 days.
Was the individual hospitalized?
I presume he was, but I can't confirm that.
And do you know what area of town, or what, do you have contact tracing with teenagers? You know, everyone's probably really worried. Are you testing more teenagers today because of that?
So my understanding is that this was a case that we had identified previously, and so we'd already been engaged with the contact tracing with this individual already. So
meaning like family or something may have had it. Is that what you mean?
I know that this was a case that we had identified previously, and now we're reporting that they have passed away.
Okay. Do you typically at all of your testing sites test a lot of teenagers? What are the numbers like on that?
I think we have on our demographics page an age range of who's tested positive, but I don't have the full count for you of people that actually go through testing, and we don't receive that information for lots of the population that goes through the healthcare system.
Does it scare you that it's a teenager? I mean, I think people are going to be, that's, you know, not that every death is very scary, but with a teenager, that's going to really hit a lot of people hard.
Yeah, it's scary and it's tragic. And it's, at least if there's some good that can come out of this, I think it would be for all of our teenagers and young population, our children, to understand how important it is that they take these actions and follow the recommendations that we've made in the governor's directives to be able to help to protect themselves and others to help save their lives.
Okay, we got about 5 more minutes. If there's any follow-up questions for Kevin and or Scott.
Hey, Kevin, Scott Sutler at AP. I'm just curious, we heard yesterday that one of the larger casino hotels on Las Vegas Strip has started accepting reservations effective May 15 and making plans tentatively to reopen then. As a health official, does that give you any heartburn, or do you think that we should be in pretty good shape by then if these trends continue as they have?
I don't know if them taking reservations gives me any heartburn, but them actually opening up on a time frame like that, I don't think is realistic. And I don't expect that that's where the governor will be going with the phased approach that he's mapped out for us as to how we would reopen as we move forward in a gradual manner with this.
Hi, this is Lucia Starbuck, and I was wondering what steps is the health department taking to expand the contact tracing? Are you guys like recruiting and hiring people? What does that look like right now?
We are currently working with the National Guard, and so they've provided us with additional resources. One with the test collection on the post that's allowed us to be able to redeploy other staff that can be involved with that contact tracing. We're continuing to train the Guard and additional individuals in roles that they can play with that and that they can support us with. We also have volunteers from other departments at the county have been working with us. We're developing plans for how we could do the additional ramp up in staffing for moving forward into the longer duration that we'll need to have that capability until we have a vaccine that's been developed and has been provided to our population. So that will involve, I think, as we move forward, hiring and staffing additional COVID Army, we're calling them, to be able to provide that workforce moving forward as we reopen and we have to provide the other services that our health district staff and county staff do in their real jobs versus how we have them redeployed now in this initial response.
Got it. Thank you. And then I do have a follow-up question. I am hearing that there is going to be a second Reopen Nevada protest, and this one will be held in Reno. I was wondering what the health district's response to this, and will there be any enforcement of like being 6 feet apart, wearing masks, or anything like that?
We don't have an enforcement role with that, but I would strongly encourage the protesters to please follow that direction from the governor. Maintain your social distancing. It's our right as Americans in a free democracy to be able to protest and to have our First Amendment right of freedom of speech. And I respect that and I value it. But I also value all of their lives. And I've seen in some of the other protests that I've seen on TV where people were right next to each other and creating conditions in which you could have an enhanced spread of disease. And so I would ask them to please care for themselves and one another while they're exercising their freedoms provided under the U.S. Constitution and work as best they can to try to prevent the spread of the disease.
Thank you.
Thanks. We'll take one more question, then we'll adjourn for the day. Any final questions for Kevin? Okay, very good. Thank you all. Have a wonderful weekend. We'll do this again Monday at 11:30 and look for some more information here in the days to come on the plan to test people. Thank you, Kevin, for your time.
Thank you, Adam. Thanks to everybody.
Thank you.